Let's go.
Access was such a focus for us in 2025. Every step of the way across the entire care continuum, we're making access better and faster for our patients.
Today's a really exciting day as we announce the opening of a new hospital. It'll be opened in late 2031 to serve our Santa Clara community. We also just opened an incredible facility about a mile away from here with ambulatory care for our patients.
Building a large, dedicated neuroscience building at the Mission Bernal campus so that we can bring together experts across neurosciences, also improving rehab, access to therapies, and imaging all in one building so that the patient can come to a single center to get all the care that they need.
2025, as we see it in the East Bay, is like a takeoff for us. The project in Emeryville, which is going to be a couple of medical office buildings, multi-specialty buildings, anchoring a hospital, providing comprehensive care to the community.
The Folsom Care Center, the opening of the Arden Care Center, we're bringing the best doctors to town, and it's just going to be great for our patients.
I think one of the biggest challenges, and certainly everybody became acutely aware of it during the pandemic, was our challenges around mental health. And I don't know of any health system that's taken that on as a priority other than Sutter Health.
We are opening up the first Sutter Urgent Care Center in San Francisco. What we want to do is provide care to the community, but what we also want to do is provide access to the Sutter network.
We have had wonderful years of recruiting for the past 2 to 3 years, but the real heart of recruiting is not just getting bigger, it's about providing more access for our patients. We serve 3.6 million people at this point in time. Our goal is to serve 4.2 million by the end of 2030.
What's delighting me about Sutter Health is the team mentality. It's everybody leaning in and really understanding the new mission statement that we put in, patients first.
What everyone needs is increased access to specialized care. That's what Sutter is doing. We collaborate as a multidisciplinary team. We bring several specialists together so that we can provide a good solution for our patients that's very patient-centered. And I think Sutter's willingness to expand those programs, I think, is also showing of their dedication to the patients in the community we serve.
When you become a learning health system, when you are an academic center that's focused not only on delivering care, but teaching future generations to deliver care, it really changes the way that healthcare is delivered. You're always thinking about cutting-edge science, evidence-based medicine, making sure that you're translating your knowledge into growing a future physician.
Care at Sutter is exceptional, and I've been proud to be a Sutter provider for nearly 30 years. Sutter is very good at taking care of patients and very good at offering clinical research and providing multidisciplinary care.
The team here is just phenomenal, very caring. I honestly don't think I would be even remotely close to where I am right now if it wasn't for this team and the care they provided.
They saved my life, so I'm going to be forever grateful, forever grateful.
In 2025,
2025, what's really exciting is that the organization has rallied around the grounding principles of developing a modern consumer experience.
One of the best parts of Sutter that I've experienced is the integrated aspect of it. Immediate access for patients for all the things they need. Appointments, scheduling of tests, scheduling of treatment.
In 2025, we launched the Sutter Sync program. This is a new program that re-engineers how we deliver chronic disease care.
It's a life-enhancing tool that allows me to be in control and manage my conditions proactively as opposed to reactively.
In 2025, we launched a program with GE Healthcare, the Care Alliance, a partnership really in response to our doctors, our clinicians telling us that our imaging equipment needed some reinvestment, that we needed some new modern technology, and we needed to improve our capacity.
I'm so proud of the work that we've done over this past year around innovation. I think we really brought some big innovative ideas forward, and at the same time, we've also been innovating in things that make work easier or improve processes.
The Nursing Focus Initiative was about decreasing the number of clicks that happens in a day of a nurse. After we launched Nursing Focus Initiative, one of our nurses wrote me a note and said that today I was able, because my charting was done, to go sit with a patient and hold his hand and be there when he passed, because he had no family, so he did not die alone. That's what Nursing Focus is doing. It's giving time back to our nurses to be right there for our patients.
This is an incredible time to be at the intersection of technology and healthcare, and I think Sutter Health in particular has a unique opportunity with its location in Northern California. And I would say in 2025, we took advantage of that with our collaboration with ADOC. I think it's really transformational to think about how do we use AI as a technology to improve the care for our patients.
Kudos to Sutter Health System, but even more so to the innovation ecosystem and the innovation team for helping to pave the way for the future of healthcare.
The Mindful Tech team, you will be moving forward in the innovation challenge.
Medicine is an art, not a pure science. If we really want to deliver care, it has to be delivered with empathy. Let's innovate on a daily basis. Let's deliver something which no other health system delivers. Sutter Health is the best.
I'm really excited about Sutter's rise in our leadership position, really throughout the nation. We are now the go-to healthcare system, certainly in California and increasingly across the country, because we are investing in our future, all to benefit our patients.
Thank you, Sutter Health, for investing in our future, partnering with our community, and helping to ensure that every resident has access to exceptional care.
I want to say thank you. Thank you to Sutter Health, WellSpace. This really matters to our community.
Nonprofit healthcare systems have a big responsibility in pulling different members of the community together, being the convener of all these different partners, and really help bringing better health to our community. Philanthropy really fuels the ability to transform as an organization, and I think this is incredibly important in the era that we are in.
The mission of the foundation is to have direct and immediate impact with the funds we bestow on organizations, and there's nothing more direct and immediate of an impact than medical.
I'm actually very proud of being a part of Sutter because they're not-for-profit, and so that means they reinvest everything back into patient care.
Our employees matter because they are the heart of Sutter Health. They are what makes our culture come alive. Knowing that you can come to work every day and bring your authentic self and make sure that you feel like you have an opportunity to thrive and grow is really what makes me most proud.
Going into 2025, we were very deliberate to make sure that we included our frontline staff in the decision-making process. We value them and we want to retain their employment.
Sutter Health University is the primary educational arm here at Sutter Health, where all of our employees can experience professional development.
The investment that I'm doing now will help me continue my growth and leadership in Sutter Health. It's really a lifelong journey.
This is our new team member, Brody, part of our new K-9 program here at Sutter. We like to ensure our staff and patient safety, and I think Brody will just really give everybody that safe and secure feeling when they come to work and when they come to receive care here.
To be one Sutter means inclusion, belonging, a sense of pride in what we do.
When we think about belonging, we talk about feeling seen and valued. We talk about being connected. We talk about feeling supported. And ultimately, we talk about being proud of the place that you work.
I just really appreciate having the opportunity to work for a company that is so passionate about this.
We want everyone to be a part of the conversation. Together we are stronger.
When I'm part of these different surges, it helps me to understand that my word has value to the organization.
I'm proud to work for Sutter. You can see the work that we do. It impacts our patients' lives every day.
2025 was another great year at Sutter Health. We get to change and save lives every single day. It's an honor and a privilege to be able to do what we do in healthcare, and our patients and communities need us.